we're going to go over how to use this pulley system for your shoulder for after a surgery, or even to improve range of motion in something like a frozen shoulder, even if you didn't have surgery. I'm Dr. Eric Broadworth.
I'm Dr. Haley Van Beek.
And this pulley system we just got right off of Amazon. Pretty cost effective. It cost us about $6 or $7. You don't need anything fancy. What we like about this is that it's got a little knob. You hook this right over the door, and Haley's going to show how to set that up. And I had shoulder surgery myself. I had a pec tear and repair, so I'm trying to improve the range of motion in my arm, and this is one of the ways that I'm going to be working on my own shoulder for my home exercises. So all you have to do, and if you have one arm, it can be a little more difficult, so Haley is setting it up for me, but you just set it up over the door and close it, and then it's good to go. And you just take a chair here, and sometimes I'll stand even and do the exercise, but a lot of times I'll have my patients sit, and I'm going to sit and show you. So with this, I want to bring this down to my hand, so it's my left shoulder, that's going there, and then I'm going to grab the other one, and I'm simply going to pull this hand, my left hand right here, is not doing any of the work, it's just along for the ride, and I'm pulling the other arm down to pull this one up. I'm going to change where the chair is. Have the chair right against the door. Hold for about 5 seconds is what I recommend. And then I lower it nice and easy down. And I like to just slowly work into that range of motion. And you could either count reps. I'll either do reps of 30, or I'll even just do it for time. So I'll do it for like 3 minutes and set a timer. Either way works, but going for some higher repetitions is always a good thing. It shouldn't be super uncomfortable. You should feel it get a little tight, stiff, maybe a little bit of uncomfortableness, but you always too, if you just had surgery, you need to make sure you follow your physician's recommendations. So you can do it facing or with the door against, with the seat against the door, just like this. The other way to do it is in standing. I'll face the pulley just like so, and do that same thing and pull. So just like this. And you could do either way. Either way works just fine. If you have more range of motion, you're able to reach over your head. Sitting is a better way to get more of that range of motion and get your arm up over your head more. I'm limited right now to about 90 degrees, so standing works just fine for me. Now Haley's going to show you how to work abduction and then some behind the back too, which can be pretty helpful if you're in the later stages of surgery working on that end range of motion, or even if you have like a frozen shoulder and you're having a tough time reaching behind your back. So Haley, can you go ahead and show?
Yep. And I'm going to sit
Going
down.
to the side.
So I've got more full range of motion. But so with out to the side, we would want to make sure that that thumb is up. And so I'm gonna use my left arm. Is going to be more like the surgical side or the injured side. So I'm using my right hand to let my left one just kind of go for the ride. Holding at the top about 3 seconds or so, and then nice and easy coming back down. Kind of do that again.
And again, that left arm isn't doing anything, it's just going along for the ride. The right arm is doing all the work.
And then, yep, we'll do internal rotation, which I want to make sure I'm a little bit not super close to the door, so well, I guess I could probably switch forward to my seat. That might be a better idea.
I think go ahead and stand, and then if we face the door, that way you can see how the pulleys are kind of set up. We'll do facing the door and then facing the camera, so you can see both.
Okay.
But you might need someone to help you. If you'll want to bring this, so if it's this arm we're trying to do behind the back, put it over like so, and then she can grip on, and now she's going to use this arm to pull down, and then this arm's going to be it's going to get pulled up by that pulley. Good. And just like that, you can work on really getting able to reach behind the back, hook and unhook a bra. This is great for if you're a female. And go ahead and show them the other way just so they can see how your arm is.
Turn around
that
this way.
Yep.
So again, may need help, but right arm is doing all the work.
Yep, just like that. Excellent. If you have any questions on how to use these pulleys, please put them in the comments below. We hope you found this super useful. Be sure to subscribe to our video for more useful health, wellness, and physical therapy tips, anything sports medicine. Be sure to subscribe to this YouTube channel.